Hello, everybody. I just want to share with you a little bit about our webinars in Somerset. My name is Marianne Williams, and I'm a specialist gastroenterology dietitian. And myself and my team tend to specialise in patients with irritable bowel syndrome, celiac disease, and non-celiac gluten sensitivity, and a food allergy that affects the gut as well. So we've got a very particular cohort of patients. And in a lot of cases, these patients are very happy to come into one-to-one clinics. They have very gut-related symptoms, often involving stools and slightly embarrassing symptoms. And they are not keen to talk about these symptoms in a group environment. And in fact, we ran groups for irritable bowel syndrome patients for 18 months. And we tried everything in the book to try and encourage patients to come, and they would always DNA, not attend, cancel at the last minute, because the feedback was that they just did not want to talk about their bowel symptoms in front of other people. Having filled the one-to-one slots very easily, we had to think of another way of addressing this cohort of patients. And so we decided, as part of an NHS England 100-day project, that we would look at webinars. And we've been so pleased with the success of these webinars. So I'm going to sort of take you through some of the data to do those webinars. And I'd really encourage anybody who's thinking of taking up this type of technology to really run with it. What I would say is there's probably no point in reinventing the wheel in each area of the NHS throughout England. If there's a very good IBS webinar, that could, in my view, be used nationally. And equally, we've also done, for instance, a low FODMAP webinar and a newly diagnosed celiac webinar. And we're looking at some paediatric webinars at the moment that the team's doing. So, you know, there are going to be all sorts of different areas of medicine and patient care where webinars would be hugely appropriate. And perhaps what we need to look at is setting up a repository of webinars that people could access from all over the UK on different subjects. So if you had a specialist in cancer care in another part of the UK, their team might do webinars in the different aspects of cancer care. If you've got somebody who's covering renal care in another part of the UK, they could do renal webinars. And you'd end up with this wonderful collection of webinars that people, GPs, consultants, patients could access anywhere within the UK. The other aspect is just making sure that they, I think, are authentic and that they're run by AHPs and clinicians for patients, and that they're not looking like commercial enterprises. They're using proper consultants and specialist AHPs to give over very specialist, high quality, reliable and authentic information. And I think with that aspect, what we've learned is that there will always be slight technical hiccups, slight technical errors when you're running a webinar. But the really important thing is the authenticity of that information going out to the patient. And I think it's really important that we keep these webinars as authentic as possible. So I'm going to start now by running you through the presentation. I'm just going to hopefully move that over. So let's just see if I can get that going. Here's our first technical error, of course. Okay, so I'm going to turn my webcam off because I really don't think you need to be seeing me throughout this. Right, so what I really want to concentrate on is that webinars really have the potential to change the way the NHS delivers patient education. And they can help patients take control of their health in this digital age that we're living in. We now communicate in an unrecognisable form to 5 years ago, with a third of us all using the internet to watch YouTube, and 4 out of 5 of us consumers preferring to watch a video rather than read about a service. And I think we all know that feeling where you'd rather just watch it visually to obtain the information you need, rather than having to sit down and read through an information booklet. So what we've also noticed that 55% of people view online video daily, with 85% of adults consuming content on multiple devices at the same time. I mean, things really have changed in the last few years. Since 2014, there's been a 203% increase in people playing videos on mobile devices. And interestingly now, one of the criticisms or cautions that we were given was, well, how are you going to make sure that everybody, particularly in a rural environment, for instance, where we live in Somerset, how are you going to make sure all those people want to take part in something as modern as a webinar? Well, when we looked at the research, it showed that the inexperience of your computer use really was not a barrier, that you would go out your way to make that work in exchange for not having to travel, not having to take time off work, not having to find childcare. There are so many benefits to being able to sit in your own sitting room and watch something where you can actually communicate and send messages and questions to the people that are giving the talk and download information sheets, etc. So we know that also researchers said that virtual technology can be used in the care of older people who may have poorer digital literacy, but they're still able to use it. So let's have a look at some of the information that we've got here in Somerset. So I'm just going to move on. I'm just going to give you a little bit picture of our team. So we've got a lovely group of 4 of us, and we all work really hard to try and put these webinars together. And we're all specialist gastroenterology dietitians working. We've got Kerry Marchant and Leah Seamark and Leslie Harper and myself. And here's a picture of us actually preparing a webinar. So we're all together doing the different technical aspects and running the webinar, the IT side, we're running the presentation side, we're organising the speakers, we're making sure the whole thing runs smoothly. So there is nobody else involved. There are no IT departments involved. It is done all by us AHPs from beginning to end. And here's a picture of the team for the last webinar that we recently produced, which was a webinar for newly diagnosed celiacs. And you've got the team at the back, and then you've got our panel that were invited to come that day, which is Jim Gotter and Emma Gregg and Danny Mill, who were coming to speak specifically on the subjects, and they're a mixture of consultants and a specialist dietitian. So you really can organise these webinars as long as you've got a team who are willing to do so and you're given protected time to get these things organised. So the 100-day project where this all started was in 2017, and we had a gastroenterology team. So that was with secondary gastroenterologists and nurses and primary care dietitians and GPs, along with trust management and finance team. And the aim of this project was to develop new solutions for old problems and to overcome barriers that were historically preventing practical and economical patient care. And the objective was to create patient education which would prevent the need for frequent duplication of information. You're quite often having to give the same information to the same cohort of patients over and over again. And that's why, of course, group environment was seen as attractive. But of course, people have still got to take time off work, travel, find childcare, find care for the elderly that they're looking after, etc. And that costs them money and time. So running the webinars just seemed like a much simpler solution, and it could reduce demand on clinical time too. So we saw the webinars as a solution, an effective way to deliver this education directly to patients. Which patients could benefit? Well, we looked at where we wanted to focus the first webinars that we were going to do. I mean, this was a very innovative idea. We couldn't find any reference to patient-focused webinars in the UK at all. The only thing I found was in America, there are some of the big charities like cancer charities who are running webinars for patients, but there was nothing like this in the NHS yet that we had found. And irritable bowel syndrome was it's a really chronic and debilitating condition which affects about 10 to 20% of the UK population. So there are potentially a large number of people that are going to benefit from a webinar like this. So considerable financial implications, with the attributable cost in the UK estimated at about 12 million per annum. So it's a very expensive condition. And what was already available for patients? Well, in Somerset in 2013, we set up a new pathway for patients with IBS. And this was the first UK dietetic-led gastroenterology one-to-one clinic for adult patients with intractable IBS. And we saw a reduction of non-red flag IBS patients who were being unnecessarily referred into secondary care from 14.3, that came down to 8.7 in the first year. So we saw a dramatic reduction just by using these one-to-one clinics. In fact, they were so successful that they were put into the NICE guidelines as a shared learning example. We wanted to reach more patients. The group sessions, as we said, we ran them for about 18 months. and the attendance rates were very poor, with only about 1 to 4 people attending. And feedback was that they were uncomfortable discussing bowel symptoms in front of others. So being one of the research information that we were looking at was a systematic review in 2018, and they said that being in the home environment is less stressful than meeting people in person, and meeting virtually provides a greater feeling of anonymity and security, and the ability to leave the group more easily. Participants preferred to see healthcare provider virtually rather than travel, with many indicating they would not have travelled to participate in a group session. And this, of course, was one of the reasons, together with not wanting to discuss their personal symptoms, this is one of the other reasons why we had such a high DNA rate. But of course, travelling to the one-to-one sessions to exactly the same place, they had no problem with, but if it was a group session, they weren't so keen to do it. So we put together a poster. Here's an easy way to find out more about IBS, which gave people the general information and how the webinars were accessible, and the simple way of just contacting us with an email address, which is gastro.webinars@nhs.net. And we gave these out to pharmacists, GPs, they went up in GP practices, they got sent out to patients, anywhere that we could think of for these posters to go up, they went up. All the community dietetic letters that went out for IBS patients enclosed a copy. The email gastro.webinars@nhs.net went out at the bottom of all the letters leaving the gastroenterology department at the hospital. They were sent out by secondary care dietetic team for any IBS referrals. Monthly emails to all GP senior partners and practice managers received a copy. There were monthly emails to pharmacies in Somerset, and we'd send out a regular Twitter feed as well on the webinars. So the gastro.webinars@nhs.net, we felt it was really important to have a very simple email address that patients and HCPs were going to remember easily. If you make it too complicated, people forget. Bear in mind, people are often seeing this in a GP surgery, might not have time to write it down, might not think of taking a quick photo with their camera, so they've got it when they get home. And the GP wants to give them the information really quickly, might not have the poster at hand. So it's really important to maximise the chances of patients interacting with these webinars, that you make the webinar contact a really easy one. And we highlighted the fact that these were online webinars, they were easy to use, no one except the dietitian will know who you are, so they were anonymous, and you can ask questions anonymously. And I think that is so important. And actually, I was talking to a student recently who was at King's College London, and she was saying the best lecture she'd been to this year was one run as a webinar, because everybody took on an anonymous name. So they call themselves Peter Pan or Batman or something. And they would ask questions, and up would come the feed. Peter Pan asks this question. So nobody had to feel stupid. So it meant that people asked as many questions as they wanted to the speaker who was giving the lecture. And he actually spent half the lecture literally going through the answers to the questions. So he gave his lecture and then deliberately kept enough time to go through all the answers to the questions. And it meant, she said, that people asked so many more questions they would have done in a lecture theatre where they're embarrassed. And she learned so much from the answering of those questions. So it really is a fantastic way to encourage people to ask questions, because they're going to be anonymous. And they can save the session and they can re-watch it again as often as they want to consolidate knowledge. How many times have you been to a meeting or gone to see a consultant or anywhere, gone to see the bank manager even, and you've walked out afterwards and you've said, gosh, what did he say? I can't remember. And it's the great thing about these webinars is they can just rewatch them as often as they want to consolidate knowledge. And that's really important when you're trying to educate patients about a particular medical condition. So encouraging patients to self-manage their conditions, and I think we really need to push this forward. We need to encourage patients to look after their condition. And the research shows that virtually delivered approaches shift that responsibility to patients by providing access to and self-selection of available resources that may be more relevant and individually suited than conventional education. So When people attend the webinar, we have a whole list of downloads. You've got to download on this webinar today. It's only one. It's an article that I wrote about our webinars with a lot of the information I'm giving you today. So it's nice and easy. It's all in one space. So do please feel free to download that while you're listening to the webinar so that you've got it. But in our patient webinars, we might have 5 different downloads. And those the patient can decide, well, I don't want that one, I do want this one. Actually, that's going to be really useful, I'll download that one. So they decide what's going to be useful to them. And the other really important thing with these is that we include a self-referral form. So we put a self-referral form as one of those downloads. The idea being that if the patient does not improve after they've done all the things that we've suggested in the webinar, they can then fill out a self-referral form and come and see us on a one-to-one basis. Now, a lot of you, I imagine, would be thinking, oh my Lord, we'd just be overrun with people self-referring. Well, much to our amazement, it's completely to the contrary. In fact, I'd say we've been running webinars now since last July, so that's just over a year, and we've probably had 5 self-referral forms back, and yet we've had about 200 people watch the IBS webinar. So I think the truth is that if they're getting the right information and they're able to rewatch to consolidate knowledge and they feel they're being empowered to take control of their own condition, they actually don't need to come and see us. So it's really interesting that people are really worried about that addition of the self-referral form, but certainly from our experience, it's not something that you will necessarily need to worry about. It's probably going to depend on the condition that you're doing the webinar for, but certainly it's not an assumption that if you put a self-referral form on the webinar that you're going to be inundated with referrals. That just doesn't seem to be the case. So what about the effectiveness of virtual versus group sessions? Well, the research shows that virtual sessions show similar outcomes to in-person groups, so that's good news. And our focus in Somerset was to simplify access for patients. We wanted to avoid the need for a GP referral. We wanted to use a webinar service that is patient-friendly and easy to use. We wanted to give access to reliable specialist advice. We wanted to supply them with downloadable patient information sheets direct from the webinar. And don't forget, that also saves the NHS money because we're not having to print them and post them out to patients or give them to patients. They can download just what they need. Self-referral forms for one-to-one advice after the webinar if it's necessary, and it gives patient control with direct contact to an email to register for the webinar. So that email, gastro.webinars@nhs.net, means that as soon as that patient has got that email address, they've got control over whether they decide to register for that webinar. And the avoidance of a need for a GP referral, we don't ask the GP for any referral. We don't know who's attending the webinars. We simply get an email from them to our gastro.webinars@nhs.net email, and we send them the registration link. So they are completely anonymous. We do not have a referral from the GPs. That saves GP time. GPs are so overloaded at the moment that it's not necessary. These are patients that would not otherwise have had any help anyway, and they've now got the opportunity to use a one-to-one self-referral form if necessary. So we're actually reaching out to many more people with the webinars than we would have done previously, and hopefully saving GP time. So they're gastro.webinars@nhs.net, really simple email address. So reduce GP workload because there's no requirement for the referral. You reduce the need for GP appointments for IBS symptoms because the staff at the front, receptionists, can direct the patient automatically to the webinars or to the poster about the webinars when they're booking to see a patient and say, well, you may have quite a long wait for the GP's appointment, but here's the email to join an IBS webinar. And we're increasingly getting emails from patients all over Somerset whose GP practice has simply told them to come and attend the webinar before they've even seen a GP. So this is really good news. Reducing the requirement for secondary care referrals. Yes, absolutely, because a lot of people, and I'm sure any GPs listening to this will recognise this situation as well as the secondary care gastroenterologist, that you get patients who come to a GP and they come over and over again with gut problems. You're pretty sure it's IBS, but the patient is really concerned that their symptoms are carrying on and that there's something more sinister going on. And in the end, the GP will refer them to secondary care for investigation, even though the GP is pretty sure that it is IBS. So that can be very frustrating. On the webinars and at the end of this session, you are very welcome. Anybody watching this is very welcome to email us on that gastro.webinars@nhs.net email, and we will send them the links to the webinars. And you'll see on those webinars that we cover red flags, we cover the risks of patients coming to us before they've seen a GP. So anybody sitting thinking, well, actually, this is all very well, but perhaps that patient should have gone to the GP first because they may have had red flags, they may have had cancer of the intestine, etc., and not be picked up because they've been lost time by going and seeing a webinar. Well, we cover all that in the webinars to make sure that patients are very aware what the red flags are and when they should be going to see their GP. So that's very much covered. But what we're trying to stop is reduce GP workload for those non-red flag referrals and reduce the requirement for secondary care referrals. Pharmacists can redirect IBS patients to the webinars as well instead of redirecting to their GP. The benefits to the NHS, of course, is that these webinars can be run by any clinician from any location as long as they've got access to Wi-Fi. There are no room hire costs. We're constantly pulling our hair out trying to find rooms to run group sessions, for instance. Well, there are no stress of trying to find rooms, and there are no room hire costs, which is fantastic. There are no administration costs either. And in fact, the room hire costs, we run the webinar out of, at the moment, mainly out of my house, which is absolutely fine because I've got Wi-Fi here, but you could run it anywhere at all. There are no administration costs because we run all the administration through that gastro.webinars@nhs.net email address. So, you know, all the emails go straight out to the patients, all the handouts are downloadable. There's really almost no administration costs at all. No literature and handout costs, as I said, and each webinar can reach at least 500 people, so that's fantastic. Each webinar can be reused on demand, unlimited times. Now, we, for the first few months, up until from July last year till March this year, were running the webinars live. Every third Monday of the month, between 7 and 8, we'd run the next webinar, and it would be the same IBS webinar each month. And that was great. And then we suddenly realized, actually, there's an on-demand facility. So the last webinar that we recorded is now the one that is automatically sent out to everybody, and they can watch it whenever they want on demand. So as soon as they receive our email, they could watch it straight away if they wanted, or they could watch it whenever suits them. They can watch it in bits. They could watch it before they put the kids to bed, after they put the kids to bed, before they go to work in the morning, in bed at night, you know, anywhere they want, they can watch it in bits and pieces. It basically, they don't need to attend at a certain time now. So the NHS points to consider is the NHS has limited time availability with clinicians. Information is easily forgotten in clinical and group setting, and webinars can be rewatched to consolidate this knowledge that might otherwise be lost. It's more efficient use of clinical time. One session reused multiple times to reach multiple patients just makes so much sense. You can have remote consultations. Remote consultations reduce the number of DNAs. Well, we don't know that. Will the use of these webinars reduce the DNAs we have in our everyday clinics? Well, the chances are that we're going to see the people that have tried all these diets, etc., dietary approaches or other approaches that we've used in our webinars and we've suggested, and that hasn't worked for them, they're going to be more motivated to come. So potentially we may have less DNAs in our one-to-one clinics, but we don't get many anyway. But as from a global perspective, throughout the UK, there is definitely the potential to reduce DNAs, but we'd also need to collect data on that and see if that actually happens. So what about virtual care versus the usual care? Well, virtual education, this is from a systematic review last year, virtual education was as or more effective than usual care in improving outcomes, including clinical indicators, knowledge, self-care, quality of life, and healthcare utilisation. So all round, a no-brainer. Measuring outcomes in Somerset, we use a web-based surveys for all our patients before and after each webinar to obtain outcome data. And that again incurs no NHS administration costs. We've set up something called QuestBack, so they fill in a very quick tick box QuestBack survey before and one afterwards. And that gives us an indicator of whether they've actually taken on board the information and learned how easy they found the webinar to use, etc., etc. And I'll show you some of the data in a second. So one of the bits of data we collect is who gave you the contact information for this webinar. And you can see that the vast majority of our patients come through the GP. So the GPs are finding this service extremely useful and recommending the webinars to patients a lot. The community dietetic service was also a big user of, or a big pointer towards the webinars, and that's because every IBS patient that's referred to us is automatically sent the webinar information. And then we've got a big chunk of other. Interesting, 6% of our patients are coming from Twitter. And I think that's really important to know, that social media is making so many grounds into communication these days, and we really need to take that on board, that actually it's becoming an increasingly important way to communicate with patients. And that doesn't necessarily just have to be Twitter. It could be Instagram, Facebook, etc. There are lots of ways to communicate, but I think it's really important to notice that that's actually a notable chunk. It may only be 6%, but that's notable. So what we looked at is, now that you've watched the webinar, how would you rate your confidence in managing your symptoms? Well, this was out of the first 112 patients. So this data comes from up until March this year. And 112 of our patients, you can see that 68% of them said that their confidence in managing their IBS symptom had improved, 14% significantly improved, and 18% unchanged. Nobody said less than before, which is pretty logical. But that means that we're talking about over 80% who had improved or significantly improved, so 82%, which is fantastic. How easy was it for you to join the webinar tonight? Well, 50% said it was very easy, 30% easy. So we're looking at 80% finding it easy or very easy, and that's really important. Only 11% finding it hard and 1% finding it very hard. And I think, you know, a lot of people said to us, oh, people will find it too technically difficult. And actually, we use GoToWebinar. I'm sure there are lots of other webinar services out there, but GoToWebinar is really user-friendly for patients. It's very easy to use, very easy to join webinars, and we have very few problems with it. Ironically, us at the technical side here tend to have a little bit more of a problem, as you noticed earlier, when I couldn't make the slides move forward. But from a patient's perspective, it tends to be a very easy service to use. How likely are you to recommend these webinars to a friend? Well, basically 100% said they were likely. You've got likely, very likely, or extremely likely, and the biggest cohort was the extremely likely. So that's fantastic. So everybody was happy to recommend these webinars to a friend. Proving patient education. We needed to prove that we were actually making a difference to patient education. Were we actually teaching patients something, or were they just saying that they found it easy to use and it made them feel better, but actually we hadn't educated them at all? So we had a question in the webinar, which is would allergy, it's not in the webinar, sorry, it's the survey before and in the survey afterwards, would allergy testing be useful in finding a solution for your IBS? This is something that a lot of GPs report back to us, that patients come in with all these symptoms and they want allergy testing, which isn't supplied readily on the NHS. It is available, but it's not for IBS patients. It would be totally irrelevant and unsuitable. It's only suitable for allergy patients who have raised levels of immunoglobulin E, and that's just not the case for IBS patients. So for IBS patients, allergy testing is absolutely no use at all. So that's something that we cover very considerably during the webinar. So you can see here that pre-webinar, 88% of people thought that allergy testing would be useful. And of course, they were all wrong. But post-webinar, ironically, the numbers are exactly the same, but in reverse. 88% said no, it wouldn't be useful. So you can see that actually, having watched the webinar, they had grasped a really good understanding of that particular point. Which is the most useful healthcare professional to seek advice from for your IBS? So pre-webinar, 11% said GP, 62% said specialist dietitian, 27% said gastroenterologist. And afterwards, in the green, you can see that had dropped majorly. Only 1% thought the GP was the best person to seek advice from, and only 5% the gastroenterologist. So that's a massive reduction. What we're hoping is that by putting these webinars out there and teaching people that actually for IBS, it's the specialist dietitian that you need to see, not requesting referrals to a gastroenterologist and not going to see a GP. Hopefully we're lessening the load in both primary and secondary care and appropriately directing patients so that they actually get the advice they really need. Now, obviously, depending on what your webinar is about and who it's aimed at, will depend who you're trying to direct patients to. But it's really important that we're educating patients not only in the knowledge for their condition, but in the knowledge of who they should be going to see. Which of the following were important to you when choosing to attend the webinar? Well, you can see way out there was getting access to accurate and reliable information. And I think this goes back to what I was saying at the beginning, that it is so important that these are authentic webinars run right from the ground upwards by allied health professionals and clinicians and consultants, etc. But basically HCPs, healthcare professionals, should be in charge of these webinars, running them, setting them up, giving the presentations, answering the patient questions, and that's what gives them credibility. And the NHS has a wonderful name all over the globe. I know that it comes under a lot of pressure and stick from the newspapers, etc., but the NHS is an amazing organisation, and it is very, very giving very accurate, reliable information. It's very trusted globally. And it was really interesting that that was the big thing that people said, was getting access to accurate and reliable information. The problem a lot of our patients have is Dr. Google. And you go on Google looking up information about your condition and your symptoms, and you could end up getting completely paranoid, and not to mention getting completely the wrong end of the stick and the wrong information. And we get, for instance, with our patients, getting all sorts of conflicting wrong information on dietary intervention for their symptoms. So I think the really important thing with these webinars is that we get a repository of good, reliable webinars run by clinicians that are for the NHS, that patients throughout the NHS can use. They can be sent to them by their GP, by their consultant. They can be given a prescription of webinars that they watch, for instance. So really interesting that that came back as one of the big reasons that people wanted to attend the webinar. The other big one was no need to take time off work, and that really can't be underestimated. If you can get the same information from watching a webinar that you could get from going to a group session where you had to take time off work, travel halfway across the county. I mean, for us in Somerset, it's a big county. There's a lot of travel. It could be an hour and a half to get to a group session. It becomes really relevant for people not having to take time off work. Being able to ask questions during the webinar was also really, really important to people. And people put an evening session down there as well, because that meant that they could actually attend after work hours. And you can see there, no travel required. And that might be different levels of importance depending where your webinar is based or who you're appealing it to. But actually, if you're going to do a webinar that's going to go out nationally, it'll be really interesting to see what statistics you get from that. So is age a barrier? Because a lot of people say to us, well, you know, it's all very well, this is only going to appeal to the young. Well, the majority of studies targeted interventions for people aged 50 years and older, indicating, contrary to some opinions, technology can be used in the care of older people who may have poor digital literacy. And that was from a systematic review this year. So age is really not a barrier at all. So, is technology a barrier? Inexperience with computer use did not appear to be a barrier for participants, with many studies reporting that technology was easy to use. Acceptability was high in different age-related and content-related groups, and the benefits of being able to take part in a group from home often outweighed the frustration of IT problems. So, people were actually more likely to battle through those IT issues if it meant they didn't need to travel and go to a group session. So in the Somerset IBS pathway that we have at the moment is that IBS patients who go to their GP get referred to the community dietetics for first line advice, and we send them the webinar or literature. Intractable IBS patients self-refer specialist one-to-one dietetic gastroenterology service if they haven't had success with the information from the webinar or the literature that we send them. So 61 to 74% improve and are discharged, and those that don't improve get sent to the GP for referral. So although I'm saying that for our Somerset IBS pathway, the IBS patients go to their GP first and refer to us, in fact now, since I put this pathway slide together, now I'd say we'd almost need to add an extra box in there at the beginning, which is patients may just see or hear about or be told about the IBS webinar and sign up for it. So they never necessarily even gone near a GP surgery, let alone seen the GP. So I mentioned briefly there webinar prescriptions, and this is a cut and pasted slide from a list of webinars that were being given out by the Freelance Dietetics Association. Well, there's no reason why we couldn't do the same. Why could we not have webinar prescriptions? We now have an IBS first line webinar, and if you watch that, that leads you on to the low FODMAP diet webinar. So we've now got a low FODMAP diet webinar, and then for celiac patients who are newly diagnosed, we've got a newly diagnosed celiac webinar. So we can add and add and add to that. We're just doing research at the moment with celiac patients to find out what other webinars they would like us to produce. And it could be that we produce little short 10-minute webinars on particular subjects like lactose intolerance, for instance. I mean, the possibilities are endless, and there's no reason why we couldn't have webinar prescriptions. So in summary, the webinars are simple for patients to access. We discovered with our data that we collected. Age is not a barrier. Technology does not seem to be a barrier either. They all mostly found it very easy to use. It's cheap for the NHS in both time and administration costs. It can be rewatched unlimited times to consolidate knowledge. That's really important. Outcome data shows excellent education. So we realized that with the outcome data that people were learning and getting educated, and it can reduce GP workload. So take the need for GPs to refer to our service, to refer into secondary care, etc. We can reduce GP workload and can reduce secondary care referrals as a result as well. And it's a more effective use of clinical time. Could we have webinar prescriptions is what I was mentioning just there. So fundamentally, YouTube reaches 1 billion users every month and has absolutely transformed information giving in little over a decade. Well, there is no reason why the NHS could not embrace webinar technology and transform patient-focused health education in exactly the same way. So I just want to say thanks for listening to everybody and leave you here with our little poster that we've got and the Gastro Webinars email address, and let you know that we now have 3 webinars: the IBS First Line Advice, the Low FODMAP Diet for IBS, and Celiac Disease Newly Diagnosed webinar as well. And we've also actually set up a Twitter account called Gut Webinars. So you can find us on Twitter at Gut Webinars. My personal Twitter account is Allergy Diet. But Gut Webinars is excellent, and we're going to be promoting the webinars as we develop them through that Twitter account as well. So please do feel free to contact us. We'd love to hear from anybody, and if you want us to send you the links, then that's absolutely no problem at all. We'd be delighted to send you the links, and we look forward to producing more webinars. Thank you very much for listening. Bye-bye.